Hi everyone, it's Mimi. Today I'm going to be talking about strokes. Strokes kill 140,000 Americans every year. That is one death every 4 minutes. Nearly 3/4 of all strokes occur in people over the age of 65. So if you have grandparents or older loved ones, this would be a good video to watch. So what is a stroke exactly? A stroke occurs when your brain is deprived of oxygen nutrients because the blood supply is interrupted or reduced. The most common cause of a stroke is a blockage in the blood vessel. This is called a blood clot or a thrombosis. When the blood clot lodges its way in the vessel becomes blocked by the clot, and blood cannot pass or enter into the brain. Within minutes of inadequate oxygen supply, the brain tissue can begin to die off. Sometimes the clot can dissolve on its own and blood flow is restored to the brain. This is known as a transient ischemic attack or a TIA. This is also known as a mini stroke. Even though the symptoms go away in a few hours, you should still seek medical care because the mini stroke or the TIA could be a warning for a larger stroke ahead. Another stroke is caused by the rupture of a blood vessel in the brain. This causes a lot of pressure and causes a lot of blood loss to the surrounding areas in the brain. This is called a hemorrhagic stroke or an intracerebral stroke or an ICH. Only 13% of strokes are hemorrhagic strokes while 87% are TIAs. For both types of strokes, TIAs and ICHs, immediate medical attention is very important for the best odds of recovery. Knowing the signs and symptoms of a stroke can make a really big difference in how you identify a stroke and how quickly someone can get care. Using the acronym FAST can help you identify the signs and the symptoms of a stroke. F stands for face. Stroke patients usually have the first symptom of facial drooping or stiffness. You can test this by asking the patient to smile and seeing if their face is symmetrical. A stands for arm weakness. You can test this by having the patient hold both of their arms out to their side. Weakness and flaccidness can also occur in the legs. Usually, flaccid arms or legs is restricted to one side of the body. S is for speech. Patients with stroke usually have slurred speech and trouble understanding what you are saying. To test this, you can have them repeat a simple sentence or just ask them simple questions to see what their answer is. Lastly, T is for time. You should call emergency services right away when you see these symptoms appear to get help as quickly as possible. When a patient arrives at the hospital and there's a possibility of a stroke, the medical professionals will order a head CT to determine the underlying causes for the symptoms. There are two main treatments for strokes in the first couple hours. The first treatment is called tissue plasminogen activator or TPA. It is the only FDA-approved treatment for ischemic strokes. It is a blood thinner that works by preventing the enlargement of blood clots that obstruct the brain. The second treatment is called thrombectomy, which is a minimally invasive procedure to remove the larger blood clots from the vessels of the brain. Thrombectomies are a life-saving procedure and mostly performed in emergency situations. The main goal of strokes is to prevent future strokes. There are some modifiable risk factors can cause strokes. The most common modifiable risk factor for strokes is hypertension, which is high blood pressure. Decreasing your blood pressure will give you the greatest decrease in risk for possible strokes. The second factor that puts you at risk for strokes is smoking. Smoking doubles the risk for a possible stroke in the future. The third risk are people who are diagnosed with diabetes. Diabetes increases the sugar in your blood, and this can lead to damage of blood vessels. Lastly, the modifiable risk is having high cholesterol. Having high cholesterol narrows the blood vessels, which can lead to clots. All of these are risk factors that can increase your chances for having strokes, but they're all modifiable factors. This means they can be reduced with lifestyle changes and medication to decrease your chances of having a stroke. So educate your loved ones about living a healthier lifestyle and visiting the doctor yearly, and letting them know if you have any of these symptoms. These are some community resources that are available to everyone. I've attached the link to them below. The first resource is the National Stroke Association. On their website, you can find links to support groups that are locally near you and also information how to start and run your own support group. They also have a stroke helpline that you can call if you have any questions about stroke prevention, treatment, or recovery. My second resource is the Center of Disease Detection. You can also look on the CDC, which is the Center of Disease Control and Prevention. Here you can find stroke resources for health professionals. You can find health, education plans, journals, and publications on the research of strokes. That's all I have for you guys today. Thank you for watching, and I hope you learned a lot about strokes.